All right, so I'm going to go ahead and give an overview of our speaker today. So I'd like to introduce everyone to Darly, and she's an occupational therapist and the owner of Revive Rehab. She's extremely passionate about her work in the field of occupational therapy. She has more than 20 years of experience working in different settings, including inpatient, outpatient, school systems, assisted living, and skilled nursing facilities. Darly's true love and passion lies in neurological rehabilitation and pain management, which led her to seek extensive training in myofascial release techniques and the neurodevelopmental technique. An MFR, we'll call it moving forward, myofascial release is one of the most innovative and non-invasive pain management techniques in the healthcare field today. Darly continues to educate herself under renowned experts in the industry, including studying the neurodevelopmental technique at Loma Linda University and myofascial release under founder John F. Barnes. And without further ado, I will go ahead and pass off our webinar today to our speaker. I'm going to go ahead and stop my share, and then feel free to go ahead and get your PowerPoint pulled up.
Okay. I just need to share screen.
Yep, and just make sure you optimize, to share the sound for video.
Okay.
Perfect.
Right.
And I'm able to see that.
You can see that. Okay. Good afternoon, everyone. First of all, I really want to thank you all for taking the time and effort to be here today to listen to my fascial release. I'm hoping that this webinar is going to enlighten you on what myofascial release is all about and how it helps with pain management. My name is Darly. Okay, here you go. My computer is a little slow. My name is Darly Thoppil. I'm an occupational therapist, and I started my journey as an occupational therapist 25 years ago in a subacute rehabilitation center. And I worked there as an occupational therapist, and most of my patients were geriatric, and most of them were neurologically impaired. So they were either stroke patients or brain injury patients. So soon after starting to work, I realized I need to get specialization, because what you learn in college is not enough to treat any stroke patients adequately, in my opinion. So I went to Loma Linda University, got my training under neurodevelopmental technique from Walid Al-Aboudi, who is one of the best instructors for training in the neurodevelopmental technique. So my first specialization was neuro rehab. So I did a lot of work in stroke rehabilitation. And one of the missing link in my rehabilitation process was pain management, because most of the patients that suffer stroke either during their rehabilitation process or, caregivers caring for them would end up hurting their shoulder or their back. And then it would become a neuro patient has now become a pain management patient, because the whole neuro rehab would stop if you don't know how to take care of the pain. So as a therapist 25 years ago, I would do ultrasound and e-stim and TENS, and I had a little bit of success, but not enough to make the patient participate in rehab, in their neuro rehab. So I needed to find something to educate myself on how to take care of their pain. So I started researching, and one of the things that intrigued me about John F. Barnes's method of myofascial release was it was a gentler approach, and it had permanent resolution to pain. And this is exactly what I was looking for. So I could combine myofascial release with my neuro rehab and was able to help my patients a lot better. So I started taking myofascial release courses about 12 years ago. And soon after taking the courses, I realized that the outcomes of treatment were so different. So 11 years ago, I started my own company, Revive Rehab, to do myofascial release as my primary modality of treatment. We are fortunate over the last 11 years, we have grown from a one-person clinic to now having 7 therapists, all specializing in myofascial release work. And that's our passion for professional world. Like in my professional journey, I think my fascial release type gives me a lot of joy in the treatment. And we have been able to grow as a company because of this treatment techniques in pain. So personally, I am happily married, and we have a 6-year-old son who is the joy of my life. He's my sweetheart. Um, in our clinic, we do myofascial release as our primary modality of treatment, but of course we do all the other things such as stretching and strengthening. We do use ultrasound and e-stim and TENS if needed, but main primary modality has always been myofascial release. Our clinic is located off of Hodges and JTB, kind of central. I used to be in Ponte Vedra Beach, and then we moved to Hodges area just so that we wanted to be central to the Jacksonville area. Okay, that's about me. And now we're going to talk about the objectives of this webinar. So the objectives for this webinar, when I was creating this webinar, is to make you guys understand what the fascial system is, the anatomy of the fascial system, and to understand what is a myofascial restriction, and also to understand what myofascial release is all about. And I also wanted to include what conditions does myofascial release help with? What are the, diagnoses that myofascial release can help? So so I just wanted to, in this 1 hour, try to do my best to give you that understanding of what fascial releases are and what fascia is all about. So what is fascia? Fascia is a tough connective tissue that is 3-dimensional, and it starts from the top of our head and goes to the bottom of our feet without interruption. And the fascia not only supports everything, but it also penetrates all the muscles, all the nerves, all the organs, all the bones, everything in our body down to the cellular level. Now, if I have to give you a visualization of how fascia is in our body, inside our body, I'm talking about living fascia, then you will have to imagine a spider web, but a 3-dimensional spider web that starts from the top of our head and goes all the way to the bottom of our feet, encasing our entire body. And imagine that is filled with fluid, a gelatinous liquid in that spaces. Now, another visualization I always like to give my patient is everybody knows what a gauze is. So if you see have a gauze and you stretch it and it is stretchable, that's how the fascia is. Fascia is stretchable, but there are a lot of holes in it, or spaces in it, and those holes are for the nerves and the arteries and the blood vessels to go through it, and for the fluid to pass through it. So if you can get that imagination in your head and imagine that we are this spider web inside our body which is filled with fluid, gelatinous liquid, and inside all of that spider web is our organs and muscles and bones and everything that the brain and the spinal cord encased in that is the fascial system of our body. And we're going to talk this picture over here, this is a picture of fascia, and this is the muscle that it attaches to. It not only attaches, but it actually penetrates every myofibril of the muscle. So it is present everywhere in our body. It is around every cell of our body, and we have trillions of cells in our body. So before we even dissect talk about the anatomy, I wanted to show you a video of what fascia looks like in reality. While living fascia and dead fascia is completely different. And Dr. Guillemberto, he is a French hand surgeon who actually first discovered living fascia. I mean, he captured it on the video. We always had it, but he captured it on video. Dr. Guillemberto was puzzled why some of his patients were doing so good after surgery, and then some of them will not do anything. And he could not understand why his surgeries were so different when the method of operating was exactly the same. So he started putting little cameras into his patient's forearm and captured the videos of actual fascia in functioning. And he created a DVD called Strolling Under the Skin. So if you go on YouTube and type in Strolling Under the Skin, you would see a lot of the clips of his DVDs. And I have one of the clips here that I want to share with you guys because it gives you an understanding of living fascia. So let me pull this up, and I'm gonna turn this on. Are you able to hear it? Okay, so this is how the living fascia is inside our body. Look at all these spider webs, and this piece over here is actually a myofascial restriction, which is basically multiple of these spider webs joined together. And you can see here, when you apply traction, the branch, see how this separates? Did you just see that? And that is what happens in myofascial release. It separates these restrictions that are in our body. When you apply gentle pressure and hold it, it will actually separate it and make it more fluid and elastic. So here we see this fascial web, and these are the fat molecules and how it is embedded in that fascial web. And you can see a little artery in here. There is an artery, and how the blood vessels are inside the fascial web. And there's fluid all over. And look at the movement of the fascia. And it encases every artery, every nerve. And as you can see, these filaments are hollow and they're fluid, filled with fluid. And they can easily separate. And look at that is the forearm of a patient. And shut this off so I can. All right.
Darly,
So
I'm going to have you pause right there real quick. So the video is
Mhm.
coming in clear, but if you can stop your screen share for a minute, and then when you go to reshare it, select just to share your PowerPoint, because it's making the PowerPoint fuzzy for some reason.
Okay, so do you want me to like stop share?
Yep, go ahead and do
right
stop
now?
share.
Okay.
And then go ahead and do share screen. And instead of selecting your entire screen as an option, do just your PowerPoint program. And we'll see if that corrects some of the font was a little bit fuzzy coming in.
Okay, let me see. Just the PowerPoint slideshow?
Yes, go ahead and try that option for me.
Okay. All right. Okay. Is that good? Did that help?
Yeah, it's coming in a little bit fuzzy for some reason, but we'll go ahead and continue on.
Okay. I don't know how I'm not sure how to fix it on my end.
Yeah, that's okay. Sometimes it's just a connection related issue, but we'll go ahead and continue on, and then we'll share out the slides after the event is all over.
Okay. All right, so that was fascia, the living fascia that Dr. Giamberto has actually recorded, and it is available on his DVD called as Strolling Under the Skin. So now let's talk about the anatomy of fascia. So a fascia has got three components in it. So one is the elastin, which is basically the elastic component of the fascia. The elastin is what gives the fascia the elasticity, and that's why our movements are so smooth, because without the elastin component of the fascial system, our movements would be choppy. It's elasticity that gives the flexibility that it needs to move. The second component of the fascial system is called the collagen. The collagen is the collagenous or the plastic component of the fascial system. The main function of the collagen is to give support and strength that is needed to support all the important parts of our body. And ground substance is what you saw in that video, the gelatinous liquid that is surrounding all those fibers and inside those tubules. And so that is the ground substance. That's the liquid part of the fascial system. And this liquid actually forms the environment for every cell in our body, because fascia is not just the covering of the muscle. It actually penetrates the muscle into the myofibrils and into the cells of the muscle. So it becomes the environment of every trillion cells of our body. So no part of our body can escape the influence of the fascia. And fascia, if we have to talk about fascia, like from the head to the toe, but it is also from the skin level, from below the skin level, also to the brain and the spinal cord. It can also be divided like that. So the superficial fascia is the fascia that is just below the dermis level of the skin, and the deep fascia are the fascia that penetrates the muscle and the organs and down to the cellular level. And the deepest fascia is actually the covering of the brain and the spinal cord, so which is called as the dura of our craniosacral system. And that fascia is the strongest fascia in our body. And of course, it has to be the strongest fascia in our body because it supports our brain and the spinal cord. So fascia at the cellular level creates the interstitial spaces and has extremely important functions of support, protection, separation, cellular respiration, nutrition, elimination, metabolism, fluid, and lymphatic flow. So fascia has a lot of function that we probably don't even know half of its function yet. But any trauma of the fascial system or any kind of myofascial restriction could also lead to cellular efficiency, poor cellular efficiency, necrosis, disease, pain, and dysfunction throughout the body. And this is what fascia looks. This is actually a drawing, but you can see that right underneath the dermis layer of the skin is the spider web of the fascia, and these are the tendons, and the filaments of fascia penetrate into the tendon. One thing I really want to mention is the telescoping mechanism of the fascia. So if you imagine there's layers and layers and layers and layers of fascia, fascial sheath, And in between those sheath is this gelatinous liquid. And when that gelatinous liquid gets really hard or solidified, then what happens? The two layers will not glide. And when a practitioner or a myofascial therapist performs myofascial release by doing cross hand releases, what happens is the compression will cause that ground substance or that solidified ground substance to melt. And this is what happens when it starts to melt, it will glide. And when it glides, it actually increases the length. You see that? It's not stretching just like a TheraBand would stretch. It is actually gliding of one layer of fascia over the other layer of the fascia because of the ground substance. So there would be multiple layers, and every layer is gliding on the other layer because the ground substance would melt by the time you're doing the fascial release. So it's very important to imagine that when you're getting a myofascial release treatment is the gliding motion, because the telescoping motion. Um, so when you do a myofascial stretching, I teach in my classes that you have to really imagine that somebody is like stretching your arm and you are actually experiencing the telescoping effect of the fascial stretch. So I just wanted to make that clear. When I see this picture, it always reminds me of that telescoping effect of the fascia. What else does the fascia do? Fascia supports and stabilizes and enhances the postural balance of the body. Of course, the um, the collagen in our fascial system is so strong that is able to literally support ourselves. If we didn't have fascia in our body, our organs are not going to be where they are. Our stomach would be at the floor because the skin cannot hold. It is not the skin that holds the organs in place. It's actually the fascial system of our body that keeps everything in its place. And so that is a very important function of the fascia. The other function is that it is very, very important in movement. So, and it acts as a shock absorber. This is crucial because if you imagine, if you weigh 150 pounds, and if you know the skeletal system of our feet, there's like little bones in your feet, and then there are like little metatarsal bones, and then there are little phalanges. Imagine putting 150 pounds on the calcaneum, it will crush these bones. But the fact that our bones don't get fractured is because when our weight from our heel touches the ground and the force is transmitted to our body, the fascial system, that spider web, the force is like dissipated into all these different webs, and the force that goes on the calcaneum bone or on the metatarsal is hardly anything that could break a bone. So if it wasn't for the fascial system, every step you take, you would have a fracture in your bone. But so the fascia acts as a best shock absorber for our body. And during an accident, if we didn't have any fascia in our body, the accident would be a lot worse than what it is now. Fascia is also a major area of inflammation and infection. It is a plane where it can go through, travel through the fascial planes. So we have to be mindful of that. So we do not treat somebody with acute infection because we don't want that infection to be spread throughout the fascial plane. Fascia is predominantly vertically oriented. That means it starts at the top of our head and it goes down three-dimensionally, but in a vertical format. except in certain areas of our body. So every joint in our body would have transverse fibers that go, along with the vertical. So you would have vertical fibers and a transverse fibers along every joint in our body. We would also have this transverse planes along the base of our head, cranium, around this thoracic inlet area, around the respiratory diaphragm area, and around the pelvic floor. Now, these are areas where you need extra support for these different organs that needs to be supported. So that is one of the reasons we are blessed with this fascial system that has extra support in these areas. But on the flip side, when these areas get injured or restricted for whatever reason, then you have then the effect of that is severe, because that little space at the base of your neck that got restricted can really pull the vertebrae and the disc out of alignment, can trap your occipital nerve, that can give you a major headache or a migraine. So it's very important to understand that these major areas are protected by strong fascia, but at the same time, when this fascia gets restricted, then if the dysfunction is also major. But it is probably unfortunately, none of our testing, like any of the standardized tests, show us where these fascial restrictions are. So it is mostly ignored. Another thing it is mostly ignored is because of our medical training. There are 3 myths of medical training. The first myth, that I went to school like 20 years ago, 25 years ago, and nowhere we were taught anatomy on cadavers, and the fascia in a cadaver is completely different than a living fascia is. And we were taught the anatomy of the cadavers using the cadavers, and all we did was cut the fascia to see what was inside it. We never once thought what could be the function of the fascia, and what we know now, we did not know then. So our anatomy was incomplete. All we thought about was, okay, cut the fascia, see where the muscle originates from, look where it is inserting, find out the nerve that supplies this muscle, and figure out the action of that muscle. So that muscular portion is incomplete, because the movement is not just by the muscle. The movement is by the muscle and the fascia along with it moving. The tendon, we talk about the tendon, every tendon has a sheath, and if the sheath is stuck to the tendon is not going to be working like the way it's supposed to. But we completely ignored it in our training. The second myth that we had when we were taught was, we were taught human body as a linear body, but we now know that it is not at all linear. And the third myth was taught was that our bodies were closed system. Our education was also like that. We were taught, we're going to go over the skeletal system, the nervous system, the respiratory system, the circulatory system, the reproductive system, etc. But these systems are not closed. Fascia is the environment for all of these systems and can communicate to each other because of the fascial system. So some of our training were not correct. Luckily, we have more proof now and of what the fascia does. So hopefully in the future generation, they would be taught better than what I was taught or we were taught in our generation. So what causes pain and what is myofascial release? There are many reasons for pain, but myofascial restriction is one of the main reasons for causing chronic pain. What is a myofascial restriction? You remember the video that we just saw, and you saw a clump of those spider web? That's a myofascial restriction. Myofascial restrictions are areas in the body where those elastocollagenous complex has been shortened or solidified. I want to give you a visualization again on what the myofascial restriction is. So imagine I made spaghetti like 4 days ago. And when I made it, it was nice and smooth, and we were able to eat it and enjoy it. And then I left the leftover spaghetti in a bowl on the countertop for like 3-4 days. Guess what that spaghetti is going to look like on 4 days from Sunday? Like, so today is Thursday. What would it look like? It would look like those strands of that spaghetti would stick to each other. And instead of having each strand separated out, it would be like a clump of spaghetti. It will be a blob. And that's what a myofascial restriction is in our body. It's clumped up spider webs in our body. And what causes that? What can cause a restriction, a myofascial restriction? There are many reasons for myofascial restriction. So one of the main reason is prolonged poor posture. So when a person, a lot of our IT guys out there, they're sitting in front of the computer all day long, and this is what they do. Their shoulders are forward, their head is forward, and they sit there for hours and for years. And when you have this poor posture for a prolonged period of time, the muscles around here, the fascia around here get shortened and solidified, and the ground substance around this area would shorten. And when these shorten, what happens? They would pull on your neck vertebrae and on the discs of the vertebrae, and it could cause the occipital nerve that is at the base of your cranium to be impinged, and then they start getting headaches that go all the way to them here, and they don't know what, and they're taking all this pain medication, and it helps them for a little while, but it comes back. The problem is the posture, the prolonged posture that they have been. So the fascia is now solidified in these areas. So that is very, very, very common cause. Another cause of myofascial restriction is trauma. You could be in an accident and you could get trauma from an accident, and that could cause myofascial restriction. A surgery, anytime you cut a skin and it has to create a scar tissue, that is a trauma, and that creates myofascial restriction too. Any kind of inflammation, like arthritis causes inflammation, any kind of that itis, is basically inflammation. And the more inflammation that you have in your body, the more myofascial restrictions that you're going to get in your body. So one of the things that I want to mention is that myofascial restriction, like 1 square inch of myofascial restriction can cause about 2,000 pounds of pressure in the surrounding area. So if you have a restriction here, which I think many people have that 1 square inch of restriction can exert 2,000 pounds of pressure along your neck and along your shoulder. So no wonder your disc is out of alignment, or your vertebrae is rotated, or your nerves are getting trapped in between that fascial tightness. So the results, the pain that occurs from that is tremendous. So it doesn't take a lot of myofascial restriction to actually move the bone. So the bones can be moved by a severe myofascial restriction. So just putting the bone in alignment is not going to hold that piece. in place. You have to work on getting rid of that myofascial restriction in order for your spine to be aligned or your pelvis to be aligned. The pressure acts like a straitjacket on the muscles, nerves, blood vessels, skeletal system, producing symptoms of pain, headache, restricted movement, and sometimes it causes disease. So that's what myofascial restriction is about. And this is my favorite fascia man. And if I was doing this live, I would be standing like that fascia man. But since this is a Zoom webinar, I have to go by what the fascia man is doing over here. This is a typical patient who comes to our clinic. He comes to our clinic saying, I have headaches and I have neck pain and I'm really, really tight over here. It's one side more than the other side. And the therapist looks at the patient, and of course, we want to treat that neck because that's what the patient came here for, is the headache and the neck pain that they have. But when we do our evaluation as a myofascial release therapist, we are not allowed, or it is not proper to just treat the neck, because the law many times the symptoms could be somewhere totally different from where the root cause of that problem is. So in this guy, let's talk about this. So this is a soccer player. He was playing soccer and he hurt his knee one day, and he had pain in his knee for like a good 6 to 7 weeks, but it healed after a little while of doing icing and heating or whatever, applying biofreeze or whatever, and it got better. And then he started noticing like some pain in the back of his, in the lower back area. And then after a year or so, his low back is starting to give trouble. And then after a while, he manages the low back pain pretty good. He goes to a massage therapist, treats the low back, and slowly but slowly he notices that he has more pain in his upper back. And then he is in our clinic, a myofascial release clinic, for his neck pain. And when we get this story, the history from him, he'll tell, oh yeah, 2 years ago I was playing soccer, I hurt my knee, but it got better. And about a year ago I had like this acute spasm in my low back, for the first time in my life. But after about 3 days of me resting it got better. But all of a sudden, 2 weeks ago, my neck has been hurting me a lot. This is a typical history of a patient. So when you look at this patient, you would see that the knee was the source that caused this hamstring muscles to tighten up. Now, the hamstring muscle is attached to the ischium of our pelvis. And what it does, because it is tight and it's created this restriction over here, it's going to pull that ischium. However big that pelvic bone is, it's easily movable by the myofascial restriction. So it moves, it pulls the left ilium backward and the right ilium forward. And then if that's how it is, you're going to be not standing upright, but you are standing upright. So what the body has done is compensated by contracting this QL muscle. The QL muscle will contract, but when it contracts, what happens? And it shortens, it pulls the right ilium, the right iliac crest up. So now this person has a right ilium that is higher than the left ilium. Their spine is kind of curved because, it is attaching on the spine. So when it is shortened, it's going to pull the spine to one side. So now he's also having a little bit of a scoliosis of the spine. But now if he goes this way, he'll be like that. But this is not how he is standing in front of me. He's like this. So what did the body do? The body had to contract his neck muscles to keep his head upright. But that is just too much of compensation. And now he has pain that cannot be ignored, that a Tylenol or Motrin is not helping him. So he's here for treatment. And when you look at this, and whatever you do to this neck muscle, it's not going to hold if you do not take care of this quadratus lumborum, this muscle over here, and you do not align the pelvis, and you do not take care of this hamstring muscle. It all this needs to be released in order for this neck to be better. So this is what fascial restriction can do. So it is never, or I should say 99% of the times, the symptom is not where the problem is. So you have to treat the whole body in order to have complete resolution of the pain, and not only treat the patient, but you have to advocate for them to you have to teach them things that they can do at home so that they are able to understand the alignment, or how to do the stretches, what to do in order to not repeat that pattern of pain. So this is a very good example of a patient that would walk into a clinic, and in our clinic or in any myofascial release clinic, they will treat the whole body and not just one part of the body. So let's go from here to understanding what is myofascial release. So myofascial release, of course, is the treatment aspect. The myofascial restriction was what caused the pain, and myofascial release is what the treatment is for those restrictions. So what is myofascial release? It is a whole body, hands-on approach to evaluation and treatment of a human body. A myofascial release, a myofascial therapist evaluates the fascial system by vision. First, they have to look at the patient's body three-dimensionally. They have to see whether their shoulder is high on one side, their pelvis is higher on one side, and they have to look at three-dimensional human body, the frame of the body. Another thing that they would do is to palpate. They have to lay their hands on your body so that they can figure out where all those restrictions are, where the tissue is dense, where would most likely the myofascial restriction will be in the body, so that you can release it. And the third thing, a very important component that we as myofascial release have to check, is their craniosacral rhythm. And I'm going to talk to you, guide you about, a lot of people don't know what this craniosacral rhythm is. So if you are watching me, I want you to place your hand, and I'm going to place my hand on my head over here. And I'm going to move this in the front. Okay, place your hand on your skull. And I just want you to quiet yourself and just feel the movement of your hand. And if you cannot feel yours, watch mine. I don't know if you can see me. So watch this. Watch how my hand goes in and how my hand goes out. And the whole thing is the skull is moving. And one of my patients called it, oh, my head is breathing. And that's actually exactly what is happening. It actually goes in and then it goes out. And there is this movement of our skull. So that's another myth. I should have added that to the myth. We were taught that our skull, when we are born, our skull is not joined. And as you grow up, our skull gets fused and it doesn't move. But it's really not true. our skull bones are joined like this. And when the cerebrospinal fluid, that's the fluid inside the brain and the spinal cord, when it comes up, it will actually move the bone out. And then to push it back in, they actually do it. It's very, very, very subtle. So if you press it too hard, you're not going to feel it. You just have to place your hand and feel that movement, and you'll actually feel it. So myofascial release therapist would actually place our hands on the skull of a patient and see whether the rate, the symmetry, the quality, and the intensity of that movement of the skull is normal from one side to the other. And many a times with migraine patients or headache patients, I have noticed that when you're placing it, one would move more than the other, or one would not move at all and the other would move. So you have to actually notice this discrepancy between two sides of our brain. And then you will have to do myofascial release at the cranium, because imagine this is our skull bone, but there is fascia on top of the skull and there is fascia on the inner side of the skull. So when this fascia on the inner side of the skull or the outer side of the skull gets tight, solidified, shortened, then what will happen? They will not allow the movement of the skull to accommodate the cerebrospinal fluid to go in between the brain, in all. And that's a whole different topic to talk about cerebrospinal fluid and how important it is for the functioning of your brain and spinal cord. So we do a myofascial release therapist would also figure out the craniosacral rhythm of your body, and then treat it according to what she finds. When a therapist determines the location of the fascial restriction, he or she will apply a gentle but sustained pressure on the restriction. Remember, and most of the time our pressure is like cross hand, and we go as the ground substance releases, it melts, it will allow one layer, the superficial layer, to stretch and to glide. Remember the gliding or the telescoping motion. So it glides, and then you stop at the barrier and you hold it. It's a gentler pressure, but you hold it for a long period of time, and then it'll keep on stretching it. And that's what myofascial release is. So it takes time. So anywhere between 3 to 5 minutes is when the fascia will release, or that basically the myofascial restrictions would untangle and would stretch. That is, in short, myofascial release treatment techniques. And so more on this is
I did
for
want to pause you real quick, Darly. We had a
Uh-huh.
question that came up, and the person was wondering, so the
Mhm.
actual person doing the therapy can feel where the restriction is. That's how they
Yes.
locate it.
Yes, and this is exactly the slide I was going to talk to you about. The myofascial release therapist will have to develop the feel that is necessary for the successful application of these techniques, which means as you practice, you will know when those releases are occurring, and you will know when it is only. So there is no standardized test that will find the restrictions for you. There's nothing, at least not right now. Maybe a decade from now, there would be a machine that would actually find out where the myofascial restrictions are. But right now, it's actually the myofascial release therapists feel that can tell where those restrictions are. And that's why when we do our evaluation, it's a hands-on procedure. So we actually feel for the fascia and to figure out where the tightness is and where that restriction is. And that's where we will do like a cross hand release and then wait for that releases to occur barrier upon barrier. Because you have to remember, it's not one barrier. It's not a TheraBand stretching. It's not like that. It's one barrier and then it releases and then you have to hold it and the tissue would move and then you hold it again and then the tissue would move. The tissue moves because the ground substance is what is melting, and it will allow that layers to just the spider webs to untangle and spread. I hope that answers the
I think that
question.
does. Yeah. So not
Okay.
imaging or anything like that.
Yeah, it's
really
not
the
an imaging.
therapist's
Unfortunately, yeah,
hands.
it is a therapist who will actually determine where those restrictions are in your body. And I think there is a lot of, because there is no imaging that happens, and people come to me and they say that I have all these symptoms and none of the doctors want to believe me that they are real. And it's one explanation is that there is no imaging to figure out where those myofascial restrictions are in our body. So nobody knows where those, unless they are seeing a myofascial release therapist and the therapist only feels where those restrictions are and will release it. At this point of time, that is the only method of figuring out where your restrictions are. So and even for a myofascial release therapist, it is somebody's raising a hand. Can you check that?
Yeah, we have a couple of questions now. If
Okay.
We can go ahead and move into some of these questions.
Okay.
And we'll probably have to just cut our presentation just slightly short.
Okay. Well, we're almost done with this.
Someone that was asking about is myofascial release commonly maybe used with fibromyalgia and that type of pain?
Yes, yes. And here comes our page, the conditions benefited by myofascial release.
Perfect.
So this is just a limited diagnosis that I've mentioned. Is then basically any kind of pain is what myofascial release would work on. Fibromyalgia is huge because a fibromyalgia problem is a fascial problem. So any kind of back pain, headaches, neck pain, TMJ, we see a lot of TMJ patients in our clinic, and we are able to go intraorally and work on releasing the fascia in the jaw. Frozen shoulder is huge. Carpal tunnel, pretty much any kind of pain patient is a patient for myofascial release. I do want to mention the contraindications of myofascial release before we end it, because there are a few contraindications of myofascial. One of them is acute fractures. You do not want to do myofascial release when the fracture is not healed, because healing of the fracture requires that scar tissue, and you don't want to do myofascial release on that scar tissue because you will impede the healing of a bone. You don't want to do myofascial on blood clots or when you have an active infection or inflammation. Don't want to do myofascial at that time either. Now, the tumors and cancer, it has been in the contraindication. However, the research, the more recent studies are revealing that a lot of the cancers are actually myofascial release is very much beneficial for the treatment of cancer. But at this point of time, till all the research is out and published, it's still going to be in the contraindication list. That doesn't mean, like, if you have breast cancer and you're active, then you could work on other parts of the body. It's just not going to be on the active breast cancer. But we do see a lot of breast cancers post-surgically or post chemotherapy or radiation treatment. You don't do open wounds. Of course, you cannot do myofascial on open wounds. You do not want to do myofascial release, or you want to do it very gently on advanced osteoporosis or advanced degenerative changes. You don't want to do it when rheumatoid arthritis is in acute stage. It really, really helps rheumatoid arthritis patient, but not during the acute phase. Don't want to do it when they have cellulitis or when they have a fever or aneurysm. The therapy, okay, we are these are our references. John F. Barnes, who is my tutor, my guru, his website is myofascialrelease.com. And he has a few books, Search for Excellence, that I have used for this presentation. And of course, Dr. Guillaume Berthoud, all the pictures of fascia is from his Strolling Under the Skin DVD. My contact is info@reviverehab.com or darly@reviverehab.com. Please feel free to email me. Make sure you put it on the subject that you are a participant of this webinar, and I'll be more than happy to respond to any questions that you may have. And now it's time for our question and answers. And that's my son, Joshua, the joy of my life, along with myofascial release.
Thank
All right,
you.
we can now
Yes,
open
we
it up.
have a lot of questions. So if you're willing
Yes.
to spend a little time with us, we
Okay.
will go over our time today just by a few minutes. So not too long if you guys can hang out with us, the ones who have asked questions. A few people have asked about referrals and costs. So is myofascial release typically something you're going to need a referral for? And then also talk to us a little bit about coverage insurance wise.
Okay, so in our clinic in Revive Rehab, all of our occupational therapists are the myofascial release therapists. You have to understand, myofascial release can be done by occupational therapy, physical therapists, massage therapists, nurse practitioners, anybody in medical field. It's a specialty training. But if somebody has to come to our clinic for the order has to say occupational therapy to evaluate and treat, because our profession is occupational therapy, and that requires a referral to come to us. So your doctor would have to write a referral for occupational therapy to evaluate and treat, and then write the diagnosis if it's for the neck pain or the back pain or TMJ, whatever. And then we do myofascial release. It is covered by your insurance, even Medicare, all insurances cover it as long as it's done by an occupational therapist or a physical therapist, because physical therapy and occupational therapy is covered by insurance. Unfortunately, massage therapy is not covered. So if the practitioner is massage therapist, then some insurances will not cover myofascial release therapy. But if you get treated by OTs or PTs, it would be covered.
Okay, thank you so much. And a few people are asking about some self-management options. So I'm going to go into that round of questions. So someone is inquiring about massage guns. Is that something that's effective? So a Theragun, et cetera, that's out there. Is that good for myofascial or no?
I am going to, Theragun is effective for patients who are very strong and athletic in nature. It is really not good if you are frail, because it has more harm that it can do. Then I recommend this ball, and it has air in it, and it's slightly softer. And this ball is really, really useful. And Natalie, tell me if I stand up, if you can see me, because you can use this ball on a wall, and you can press it like that to get rid of the trigger points. Actually, I have sent my YouTube video links to Natalie, and she will be emailing you. If you don't get it, then I have videos of all the myofascial stretches that I had made it during COVID for our patients. So if you go in there, and you will find like a whole body stretching using the myofascial principles, low back stretching, neck stretching, TMJ releases, use of how to use these balls. And I have a few equipment here. This is called as Sacro Veggie, and it's a great tool to have if you are a sciatic patient. If you have questions, just email me. I don't think we're going to have time to like demonstrate it, or maybe we will have to do another webinar on how to do this, but this is a very great important tool for management of, oh, I don't have my craniocradle here. So this is a Theracane, and the Theracane is used to treat like pain over here, like usually the scapular pain or upper trap pain, and it's got a lot of uses. So the principles remain the same. You have to hold it for 2 to 5 minutes before you can, and don't yank on it. Please do not. It is gentle. It's supposed to be gentle, and you're supposed to hold it long, gentle, but hold it for 2 to 5 minutes for the fascia to release. If you do it too deep, you're going to hurt yourself with a thing like that, but do it softly and hold it longer. And this is called as a Thumbi. You can order it from Amazon. And this is great because you can attach it to a wall like that. And oh, too high. So you can attach it to a wall like that. And if you have pain here, you can just kind of lean into it, and or you can, go over here and find that trigger spots and massage it. I wouldn't say massaging it is not the right term. You find the spot and you stay on the spot for like 3 minutes, 2 to 3 minutes, and then the fascia will release. Craniocradle, let me see if I can find it. I don't know where it went. I had bought, you should probably Google craniocradle. That is a really, really important tool to have for headache patients. So if you lay on that craniocradle and just allow it to relax your head on it, it will relax all these muscles over here. And people that get headaches because of the neck pain, it is used as a preventative tool to prevent that headache from happening. So that is, I also want to talk about this strap. If you're going to use my videos, I use a strap like this. It has got loops around it, and it is a great strap. It's a great investment to have, because then you can do all sorts of stretching exercises with this strap. I love it. I love it. This is another tool that you can use. This is called as a hip hero. And this is used to release the psoas muscle. Psoas muscle is like right around here. So what you do is you put it on the bed, but you don't lay flat on it. I allow, I would go down like this and just stay there with your feet on the floor to begin with. And then as you get better, then you can lay on this if you can tolerate it. But that psoas muscle is huge. It's one of the biggest muscle to release when you have low back pain, so that's one of the tools. If you have, but please share my videos to them, because all my videos have all of these things that I talked about, and you can actually, you can follow along and do the stretches, and it will really, really make a difference. If there is something, if you're doing the stretches and you have pain, stop it, because I have not evaluated you, really don't know what is going on with you. Because if there is like a disc issue, then we have to modify those stretches. These stretches are meant only for myofascial stretching. So if you're fascial restricted patients, then it would be great. But if you have pain, stop it and consult your therapist before you do it, because those particular stretches probably need to be modified. Is there any other questions?
Yes, just a couple more. We're at 106 now. So you tell me if you're able to continue. Some of these we can
Yeah,
answer in our follow-up
I
email.
can.
Okay,
I can.
perfect. We had a question about if cupping is a type of myofascial release.
Yes. So cupping is a big thing these days. And so myofascial release causes compression of the tissue. So when you do apply fascial release, it's a compression, right? Cupping is exactly decompression. So both will do myofascial release. By compressing it, the ground substance of it will melt, it melts the solidified ground substance, and that's why the layers of the fascia would be separated. When you do cupping, the Western term for cupping is myofascial decompression. And so when you do that, it still creates space between the fascial layers. It's still very beneficial for patients. There are certain I would do cupping or even like lifting in a patient who has like scar tissue adhesions. Like I see a lot of breast cancer after their surgeries. So that over there, you can actually lift it, or wherever, like on the abdomen, whenever they have, the hysterectomy scars. Or so lifting is what cupping does, and it's called as a myofascial decompression, and that is also very, very effective.
Okay. And someone was asking about the emotional component of myofascial treatment. Is there a release, or can you speak to that?
Yes, it is huge. I did not cover the emotional component of it because, this webinar would be very, very, very long. Because you have to understand that any kind of trauma, whether it's physical trauma or emotional trauma, all of those trauma gets trapped in our fascial system. So when you go through an emotional trauma, that trauma, let's put it this way. So we have in our bodies you all must have heard about flight, fight, and freeze response. Okay. So when something happens to us, your first instinct is to fight. When you cannot fight, you will, first instinct is to flight, which is run away from that situation. When you cannot run away, you would actually fight it out. Like you'll fight it. And when you cannot fight, when you think that you cannot fight and win, then you would freeze. And when you freeze and you just wait for the trauma to go over you, the last phase that nobody talks about is called as the thawing phase. Thawing phase is when when the trauma, emotional trauma happens to you, and you take in all that energy from there, the thawing phase will help you release that energy from your body. So we do have a lot of patients with emotional trauma that when we touch that area of their fascia where that emotional energy was stored, they will have an emotional response. They would either cry, or they will shake, or they will quiver. This is a natural human process. Because we are such intelligent creatures in this world, we have learned that shaking it or quivering it and letting the fear go or letting that trauma go from our body is abnormal. And when we don't do that, then that trauma stays in our body, and what does it do? It does the same thing. It solidifies the ground substance and causes pain and other things. So yes, myofascial release, the whole emotional component of myofascial release is huge. You have to, in order to experience that, when you get treated by an MFR therapist, you have to have the ability of letting go. That means your mind cannot wander. You have to be in that present moment, and then you would unwind. That's the term that that John Barnes uses. When you are in that zone, you would unwind, and that unwinding happens in a very three-dimensional way, and it helps you release all that stress or fear or trauma that you stored in your body. There is a good YouTube video that anybody that is interested in emotional trauma should watch. I think you can type in polar bear thawing or something, and it'll come up on YouTube. It's about a polar bear that gets shot, with a gun, not with like a gun. They're trying to, what is that gun called? They just shoot it.
Like a stun gun?
Yeah, they just tranquilize them because they're treating them. But that is an emotional trauma to that polar bear. And so when the polar bear wakes up, he shakes vigorously and then he sighs and then he's normal. So that's what human beings need to do, but we don't do it because we are too intelligent and our egos do not allow us to do that. That's why. Unless you come to an MFR clinic and get treated in a safe place, then it's okay. Okay, better. Yeah.
And I think we kind of answered this before, but the questions, I think you can see them if you pull up your Q&A as well, from Sergio about imaging. So there's no imaging studies that you're aware of at this point that are...
No, there is no imaging. I think there is some things in the work, but it's not happen. I don't even think it's going to happen in the next 5 or 7 years. There is no, MRIs can show a little bit, but not fascial restrictions. Yeah, there's nothing.
Okay.
Why
and
does
then his other question too, he had typed in the chat and then also in here about pain related to amputation.
What is this? I didn't understand this question. Why does my fasting dancing relieve my thigh muscle or lower back pain? Fast dancing, you mean? Oh, very, very good question, Sergio. Fast dancing, there is another mechanism which we didn't. This is a 1-hour webinar, guys, because this MFR course is huge. But he brings up a very good point, and I want to talk about a little bit about myofascial rebounding. The fast dancing that he's talking about is when you shake your body and you allow that wave to go through your body, like then it actually relieves the fascial restrictions that you have. And that's why you feel better, because when you're dancing fast or fast dancing, it actually creates this rebounding effect in your body, which also causes those restrictions to be undone. And that's why the pain gets better. Yeah, that's a good question.
Thank you. And I think so we'll provide
we can talk
links,
more about it later.
For those who have stayed on with us. And then for those who weren't able to stay for the extra questions, we'll send out links that kind of answer and speak to a lot of these that we're going over. But as far as this webinar is concerned, we're 15 minutes over now. So we're going to go ahead and conclude for today. So if you stayed with us and you might have a specific question, go ahead and reach out to me via email and I'm happy to pass it along, but you will all receive an email that compiles a lot of this info. And then just a reminder to everyone, you'll also get this in an email, but the Tai Chi webinar is the topic that we're presenting next month in the month of May. So if you're interested in that, we do hope that you'll attend. And otherwise, we'll thank Darly, our speaker today, for all of her very insightful and interesting information that you've shared. And we'll let everyone go for this afternoon.
Thank you so much. And if you still have any question, you have my email, and shoot out an email and I will answer those questions for you. Okay.
Perfect. Thank you so much. And everyone have a great rest of your Thursday.
Thank you.
Thank you.